गम तो मुझको होगा, मैं रो लूंगा। दिल तो मेरा टूटेगा, समझ लूंगा। पर अपने अंदर रखो ना कुछ भी, बात कर लूंगा। जो होता है सो हो जाए, हाँ झगड़ लूंगा। ओ पर हिम्मत ना कभी भी हारूंगा, मैं लड़ लूंगा। पर हिम्मत ना कभी भी हारूंगा, मैं लड़ लूंगा। हालात से पीछे ना भागूंगा, मैं लड़ लूंगा।
हिम्मत रखनी होगी, बट उसको बोन कैंसर है। आज वंश को सर्जरी के लिए ले जाएंगे।
मजबूरी मैं तुझसे ना डरूंगा, लाचारी मैं तुझसे ना डरूंगा। जो भी होगा जो भी होगा जो भी होगा लड़ लूंगा। बेबसी मैं तुझसे ना डरूंगा, बेचैनी मैं तुझसे ना डरूंगा। जो भी होगा जो भी होगा जो भी होगा लड़ लूंगा। निराशाएं मैं तुझसे ना डरूंगा, मायूसी मैं तुझसे ना डरूंगा। जो भी होगा जो भी होगा जो भी होगा लड़ लूंगा। बेबसी मैं तुझसे ना डरूंगा, बेचैनी मैं तुझसे ना डरूंगा। जो भी होगा जो भी होगा जो भी होगा लड़ लूंगा। पर हिम्मत ना कभी भी हारूंगा, मैं लड़ लूंगा।
Hello, a warm welcome and a very good evening to all our guests. On behalf of Indian Cancer Society, I would like to thank you for taking the time to join us as we celebrate the decade-long journey of Cancer Cure Fund. We are delighted to host a panel of eminent speakers who will share their thoughts and experiences with us. Before we start the event, I would like to share some tips to help you navigate through the event. At the bottom of your screen, you can find 3 buttons. When you click the agenda button, the agenda from today's celebration will be displayed. On clicking the speakers button, you will gain access to the speakers list. The resources button has Indian Cancer Society's cancer awareness content, which can be downloaded. And the tech support will connect you via chat to the support team for troubleshooting in case you face any technical issues during the telecast of the event. Without any further delay, I would like to introduce you to our first speaker. He is the former vice chairman of Hindustan Unilever, an ICS trustee, and a CCF GSC member. He has contributed immensely to the success of CCF team by providing constant support and guidance. And despite his busy schedules, he's just a call away. He's none other than Mr. M.K. Sharma, whom we fondly call M.K. Sir. Over to you, M.K. Sir.
Good evening and a hearty welcome on behalf of trustees and National Management Committee of ICS to all participants. A special welcome to our chief guest, Mr. Deepak Parekh. This event is indeed a celebration of 10 years of productive and purposeful work done by the ICS for serving needy and underprivileged cancer patients under the Cancer Cure Fund, but equally and more importantly, a rededication and commitment of ICS on its partner organizations to not only sustain but also scale up this unique initiative going forward so as to serve many more underprivileged cancer patients in India. The model of Cancer Cure Fund is pioneering, innovative, unique, and unprecedented in India. I have the privilege to speak about how it all started. As a believer in Hindu mythology, I will say it is both as a result of bhagya and karma. Bhagya can be dealt with in just one sentence. It was a unique constellation of some star individuals which made it happen. 3 stars from ICS, Dr. Kurkure, Mr. Nihal Kaviratne, and Hari Mundra, all 3 trustees of ICS in 2009, discussed and felt there was the need to create a sustainable model to support cancer patients. 2 other stars from our partner organization, HDFC AMC and HDFC, Mr. Deepak Parekh and Milind Bave, were the people who helped in making it happen. And of course, people like Dr. Banavali, Dr. Bave, Mr. Tushar Vora, and many, many others from TMH, who again, as a part of the TMH, collaborated and cooperated in making the whole organization of CCF work. Coming to karma, I think it was in 2009 when these 3 trustees got together and said there was a need. And these 3 people were unique. Dr. Kurkure was, of course, a renowned oncologist. Mr. Kaviratne, a business leader, but more importantly, at his heart, he's a marketeer. And Hari Mundra, a finance professional and expert of excellence. These 3 people got together and said, we need to create some kind of a business model which can make it work. And the thought was, can we collaborate with a partner organization which can create recurring opportunities for generating revenues? And they met up with Milind Bave, who very clearly, as the CEO and managing director of HDFC AMC, said we could try and launch a Cancer Cure Fund. And it was the first charity fund that was approved by SEBI, which was launched by Mr. Bave and HDFC AMC, and was a very great success. Over the years, of course, the scheme has improved upon, and not only the interest that gets earned by the investments of the donors gets credited to the Cancer Cure Fund, but also there are matching contributions which come from HDFC AMC. But making it happen and operationalizing it was critical, because donors would want to make sure that their funds are properly utilized, there is accountability for it, and there is no wastage. The things that were borne in mind in devising the scheme and operationalizing the scheme, once the mutual fund was launched and funds were raised, was to make sure that all of us have a certain amount of responsibility and accountability. So the concepts of empaneled hospitals, developing a policy framework, creating DDTs to scrutinize the applications, creating a GAC, which would actually look at all policy decisions and review the recommendations of DDT and give decisions when DDTs were in doubt. And of course, the entire staff of the CCF in the Indian Cancer Society worked in very close collaboration and efforts to make it happen. This unique collaboration had certain great benefits. The first benefit was it provided credibility. the fact that HDFC AMC was associated with an organization like ICS, which had its founders in Dr. Jasawala and Mr. Naval Tata, provided enormous degree of credibility, and therefore people were willing to put in money. The second fact that there was HDFC AMC associated with it gave comfort to many other organizations to come forward to provide this. Once HDFC AMC decided to top up the contributions of the donors with their own CSR donations of a matching amount, investors felt it was something which was creating double benefits for the needy cancer patients, and therefore they had a lot more comfort in doing it. And last but not the least, it was the very clear intention of the ICS and the CCF to make sure that our costs are kept under control. And we have always worked in ensuring that the admin costs were no more than 5% of the total funds, and 95% was actually given to the hospital. As we have gone along, we have learned and we have kept on improving the model. And more recent additions have been in terms of the use of artificial intelligence, so that when we scale up, we don't have to really depend upon a large number of doctors and DDTs, and their task can be made easier by providing some degree of preliminary screening using artificial intelligence and the past decisions of the DDTs. So that's how the whole thing started. I would personally say it was really a pioneering work, something which was unique, and the credit for this must go to late Dr. Kurkure, Nihal Kaviratne, and Hari Mundra within the ICS, and of course, a whole host of other people who have helped and cooperated in making it happen. Thank you.
Thank you, MK sir, for taking us through the decade-long journey of CCF. Our next speaker is an industry stalwart and is one of the pioneering members of HDFC Debt Fund for Cancer Cure. It was under his guidance that the dream of having a dedicated fund for cancer cure became a reality, and over the past decade has saved and impacted lives of thousands of cancer patients. I am honored to call upon the former managing director of HDFC Asset Management Company and ICS's National Managing Committee member, Mr. Milind Barve, to share enlightening insights of his journey with CCF. Over to you, Milind, sir.
Good evening, and thank you, Anne, for the introduction. Good evening, friends. I think, first of all, I would like to just thank all the members at ICS for the opportunity to speak today when we are celebrating the 10 years of the Cancer Cure Fund. I think the HDFC Mutual Fund journey with cancer treatment really started 10 years back. I still recall, as Mr. Sharma said, there was a meeting with Nihal Kaviratne, Hari Mundra, about in the small meeting room in the Indian Cancer Society office. And I was along with a lot of other colleagues from the financial services industry, bankers, wealth managers, investment bankers. And it was a very inspiring meeting. I think I came back with realization of one or two key words. It was that any good cause needs sustainable funding. And I think you can't implement anything unless you have funding. And the second is you can't have these fundings going from hand to mouth. You need it to be sustainable. But beyond that, I think the whole entire meeting was very inspiring. And I still remember coming back to my team, and we really engaged in sessions and sessions of brainstorming about what we could do to create a product. So what we did with my team was really sit back and brainstorm, create a concept create of how a mutual fund product could be made to develop, to serve the purpose of a philanthropic cause. And once again, what guided our thought process was two things: sustainable and scalable. And I think that was something that we also needed to make it the most tax efficient. And of course, navigating through all the issues that any new product entails. It was after a very clear, long deliberations that the team had. We came with a clear outcome of these deliberations, really brought us to what was then called the debt fund or HDFC debt fund for cancer cure. We then, of course, took this proposal and product to our colleagues in Indian Cancer Society, and then, of course, to SEBI, and then the process of actually launching the paperwork came to be done. Interestingly, this was really also the time when HDFC Mutual Fund was completing 10 years of its existence. Somewhere around 2010, we started in 2000. And many members of our team felt that instead of having the usual celebratory dinner and cocktails and so on and so forth, we should embark on something which has some impact, or do something which has a philanthropic content to it, do something different to celebrate a 10-year event. So that was really the starting point about saying that these two events, the meeting with ICS and this thinking about how to celebrate 10 years of our existence, really came together. So the first fund was launched in 2011 as a debt fund for 3 years. And as you're aware, this product envisages in returning the money back to the investor with only the income which comes in the form of a donation. The donation comes in the name of the investor, not in the name of HDFC AMC. And this fund then goes to the Indian Cancer Society as a donation which they use. The first fund with a lot of effort, and also there was a lot of learnings in how people reacted to a mutual fund, people going and talking about a product like this. Because, you know, in our industry, we are known to talk about the economy, talk about equity markets, debt markets, inflation, so on and so forth. And suddenly these guys were going and talking to people about cancer cause. So it was very unique, but very interesting. And I would say that, so the first fund, we raised about 74 crores, 72, 73 crores approximately, and created donation of about roughly about 12.5 to 13 crores over the first 3 years. The second fund, when we launched 2014, we challenged us a little bit more, and we said, what more can we do? What can we do better with the product? And how can we demonstrate a higher degree of commitment to this cause? And again, as a result of these internal brainstormings that we keep having, we decided that it is not enough to just give the donations from the income of the fund, but we from HDFC AMC can make a matching donation, which will actually double the impact of the donation or the investment. So if a person has invested 1 lakh, which earns 7,000 rupees, we would put in 7,000 rupees to make it 14,000 rupees. So it was like getting a 14% return on your 1 lakh investment. So that is how we improved the fund when we launched the second fund. We went all over the place and we raised about 170 crores. Now that fund, again, over the 3 years of its existence, created meaningful donations which went to Indian Cancer Society. During the third fund, we really pushed our envelope even more. We said we need to do this, we need to show scalability. So from 174 crores, the third fund, which was launched in 2017, we raised the bar and raised about 301 crores in the third fund and generated donations of almost close to about 30 crores per annum, which was a combination of our matching contribution and the donations which came from the fund itself. So over the 3 years, we raised almost 540 crores through 3 different product launches and created donations approximately of about 155 crores. But this was only one part of the story. The second part, and as equally important, was that we were looking and observing closely at how Indian Cancer Society was utilizing the funds. And I think there was an outstanding job done at the Indian Cancer Society by all its members about how the funds were utilized. We were extremely impressed with the very robust process of empaneling hospitals with very strong SOPs in place, monitoring of cost of treatment. We were with the way in which applications were received from the doctors, how they were screened, the process of a due diligence team of oncologists which went through each application before it was finally recommended initially to the governing council, and now I think it's delegated to more GACs. But I think that process gave us a lot of confidence that we are going out to our investors and distributors with a very clear conscience that the money is utilized very effectively and also with a very, very low administrative cost. And I think one of the things that Indian Cancer Society deserves a lot of credit is maintaining the cost of running this fund below 5% credibly for all of these 5 years, which is not very easy, particularly during the last 2 or 3 years when things have been very challenging with COVID. So really what we did at the end of this 9 or 10 year period, it's gratifying that almost 10,000 patients have got funds from this Cancer Cure Fund. So what have we done really? If you look at it, what the team at HDFC Mutual Fund did was that it married the investment management expertise we had. It combined it with the distributor relationships, the relationship with investors, and we created a product which helped to create the donations. So basically we were utilizing our own business skills, but the object was different. So I must say that my colleagues, and of course myself, we had wonderful experience of selling this fund. It was very exciting. It was sometimes challenging, but very satisfying in the end. And so in some sense, we were trying to create like a different asset class. We talk about equity, how much you put in equity, how much you put in debt. So we were going about telling people how about philanthropy. So we were trying to create a new or a different asset class for people to think, have you thought about philanthropy to allocate a part of your funds? But it was wonderful to see the response. A number of investors were repeat investors in the fund because they were happy with the work that Indian Cancer Society was doing with the utilization of the fund. So at the end of the day, I think this was something we started not knowing where it will go, how much it can grow, but we are happy with the way it has grown to help 10,000 plus patients. I'm sure this will get carried forward in some form or the other by my successor and the team at HDFC. Before I close, there are many people to thank and remember, of course. Firstly, I would like to thank my colleagues at HDFC Mutual Fund. The team that HDFC Mutual Fund had was, they really put their heart in creating the product and they sold the product with a lot of passion. So I think I've also like to thank each one of them for being a part of the product creation as well as the selling of the fund. There have been a lot of people, as Mr. Sharma said, stars in Indian Cancer Society, and it is a time to remember some of them, Dr. Kurkure, Dr. Niyal Kaviratne, Hari Mundra, who were instrumental in the initial discussions. I would also like to thank all the doctors in the hospitals that are empaneled with us, who are doing tireless work. I would like to mention that I must thank also the doctors from the Tata Memorial Hospital who have very selflessly donated the most valuable thing they have, which is time, by being a part of the due diligence team. Particularly, thank you to Dr. Tushar Vora, Dr. Nehal Khanna, and others who are members of the DDT team. Because I think their guidance in the due diligence team and their guidance during the GAC was invaluable, is the way I saw it. So at the end, this has been a collaboration, a partnership between two organizations, which is Indian Cancer Society and HDFC Mutual Fund. Very satisfying to look back and see what has been generated, what has been delivered, but a lot more can be done. But this promises to be a good beginning. So in our investment world, I will simply end by using one of the lines that we used in our marketing, the third fund. There is no better investment return than saving a life. Thank you.
Milind sir, on behalf of the entire CCF team and cancer patients, we thank you for everything that you have done for CCF. To take it further, seeing is believing. We would now like to take you on an emotional and inspirational journey of a Nannisi survivor, a fighter, a winner, and experience the positive impact CCF and its supporters are having by not just saving, but also enriching lives.
निधि मेरा 9 इयर्स की है और 6 इयर्स में प्रॉब्लम शुरुआत हुआ था इसका। थाई में पेन बोल के बोलती थी। फिर हमने डॉक्टर को बोला पैर बहुत छोटा हो रहा है ये पैर से, तो उन्होंने एक्सरे किया था। एक्सरे करके फिर उन्होंने बोला अभी उसका पैर बचा नहीं सकते। मैं हिम्मत जुटा के मेरे बच्ची को आगे लेके जाऊंगी, सबसे स्पेशल रखूंगी सर मेरे बच्ची को। सब देखे चलो, वो निधि को देख के सीखो, ये चीज़ मुझे चाहिए सर। नमस्ते, मैं निधि का मम्मी हूँ। आप सभी का बहुत बहुत धन्यवाद कहती हूँ। आप सभी का मदद का वजह से हम लोग यहाँ तक पहुँचे हैं। धन्यवाद।
Thank you so much.
Mothers are strong, very strong, aren't they? No wonder they are seen as Ma Shakti in every household. Jyoti, Nidhi's mother, has been her pillar of strength in a fight against cancer. She was determined to transform Nidhi from once being looked upon as a bechari to a strong pari and inspire Nidhi to be a role model for not only her friends, but for all of us. Congratulations, Nidhi. We are extremely proud of you. Like Nidhi's mother, we too are blessed with our own woman power. We are lucky to have a leader who is at the forefront when issues and challenges raise their head. She is by our side when things are in control. But when the accolades flow in, she takes a step back and lets the team bask in the glory. I would like to acknowledge, thanks to her drive and passion, CCF is now being recognized on global platform as well. I'm happy to call upon the former Deputy Governor of RBI, ICS trustee, and the chairperson of the Governing Advisory Council of CCF, Mrs. Usha Thorat, whom we fondly call Usha Ma'am, a leader, mentor, and guide. I would like to thank everyone once again and request Usha Ma'am to take over the proceedings from here on.
Thank you, Anne, and thank you everybody who's spoken so far. It's a real journey down memory lane, and as MK was speaking and as Milind was talking, the memories of those early days came on, and the kind of journey we have really truly traveled. I have, it's really an overwhelming experience this evening. I would now like to get on to our team of doctors who are here joined us this evening. First is Dr. Banavali from Tata Memorial Hospital, who was part of that original team of oncologists for patient selection, who brought in the rigor and the kind of diligence that went through this patient selection process. I remember, people like Dr. Parekh or Brijesh and Tushar telling me that whether Dr. Banavali attended a GAC or not, he would, after the DDT or before the DDT, go through every single application. And he really raised the bar. But I don't want to take over his story, and I would rather you hear it from his own mouth. Over to you, Dr. Banavali.
Thank you, ma'am, and good evening to everyone. So what started as a passion of a few people who wanted to do something worthwhile for the needy cancer patients knocking on the door of the Indian Cancer Society for financial help has now been converted into a very successful model called the Indian Cancer Society Cancer Cure Fund. 10 years and more than 10,000 patients down the lane, we have gathered here to celebrate this great achievement. I have been told to speak on the initial functioning of the due diligence team of the Cancer Cure Fund. As we just heard, in the initial phase, the funds were limited. There were thousands of patients to support. Therefore, the onus was on the due diligence team to make sure that the funds were used judiciously. The due diligence team members also had promised the Indian Cancer Society that they would do this. We had promised the Indian Cancer Society that the due diligence will be taken to identify hospitals that were to be empaneled, that due diligence will be taken to identify patients who had a good chance of getting cured, and the due diligence team will also make sure that the patients identified fulfilled all the financial criteria to receive help. To fulfill this, actually, the work really started when the Indian Cancer Society team and the due diligence team sat together to frame the eligibility criteria as well as to frame the SOPs regarding how to distribute the fund, because this was very important. And rather than allowing an individual member to take the decision regarding which patient to support, the due diligence team of at least 5 members would meet and collectively recommend which patients fulfilled all the laid criteria, and depending on the funds available, which patients were to be sent to the GAC for final approval. Very importantly, during this initial phase, all this was done manually. If the necessary expertise to take such a decision was not there with the due diligence team, we will call our colleagues who were experts in this field outside the due diligence team and take their opinion so that a right decision was taken. Also, actually, the all this has changed because, as we'll hear now, we have changed to another platform, and we'll hear about this in the next talk. The work of due diligence team did not end here. The team also did due diligence to make sure that the treatment outline of this patient was as per the standard of care, and the due diligence team also checked whether the charges levied were appropriate. So all this was really hard work to a certain extent. However, it was great to fun to work with this due diligence team, and we learned a lot. And most importantly, we were so happy that we could help thousands of patients at one go so that they could complete their treatment without any financial worries. I had the great privilege to work with so many in the due diligence team that it will be not possible for me to take individual names here in the short time that I have. But I was on the team from 2011 to 2019, and only when I took over as the director of academics at Tata Memorial Center, I was told to leave the due diligence team and then went to the GAC. So, I take this opportunity to thank the Indian Cancer Society for really making a great difference in the lives of thousands of cancer patients, as well as millions of their near and dear ones. And I pray and hope that this fund continues to work well till the last cancer patient who needs financial help is there. So thank you once again, Indian Cancer Society and the HDFC team for making this possible. Thank you very much.
Thank you so much, Doctor. I can never forget your quote. Because of timely help from CCF, thousands of patients across India undergo treatment with dignity. And the timeliness of the help is really what the due diligence team, made it possible. We next have Dr. Nehal Khanna, who has been a member of the due diligence team and is now currently leading it. And she is going to tell us on the next stage, the next big innovation that has come into the due diligence process, and that is the use of the artificial intelligence tool. Over to you, Doctor.
Thanks, Usha ma'am, and heartfelt thanks to Dr. Banavli for being the strongest pillar of support to the DDT. Through a decade-long journey, while we had a DDT meeting almost every week, we also saw a significant increase in the number of applications, and it did become challenging for doctors to dedicate that kind of physical time to scrutinize every case manually. This was when we were introduced to Navya, a clinically validated artificial intelligence engine to help us. Navya screens all beneficiary applications for compliance with the standardized treatment guidelines, capping of cost and cure rates as per the approval criteria. Navya enables us to conduct our meetings efficiently by reducing the time required for scanning by up to 5-fold. As the applications are online, our meetings are paperless and virtual, which helped us immensely to continue our service during the ongoing COVID pandemic. The evidence and experience gained from DDT, the survival outcomes of our patients, and the impact of the unique artificial intelligence model, this has been presented in reputed international conferences. And here, I welcome Dr. Tushar Vora, a pediatric medical oncologist who has had a long association with Tata Memorial Centre, Mumbai, currently in Princess Margaret Cancer Centre, Canada, who has been a constant support to DDT and a visionary who was instrumental in incorporating Navya to the CCF. A big thank you to our patients, all the DDT doctors, the ICS Cancer Cure Fund team, and to all who have been a part of this Nobel Act. Thank you.
Thanks, Nehal. A lot has been said, and I'll keep it very brief. The team deserves all the accolades. The journey of incorporating artificial intelligence into the due diligence process has been mentioned by Nehal. It was not without testing, not without validation. The initial 6 months were simultaneous DDT as well as the AI doing the job together, and seeing that there was 99% concordance. More importantly, there was time saving, and we have been talking about money. The most important, or rather after patients' lives, the most expensive component of the entire entity is probably the expert's time. So what we have demonstrated through the use of AI is 5-fold decrease in the time which is required for scrutiny. The same time can be used for many more applications to be screened and many more lives to be saved. So again, keeping it brief, probably incorporating AI was like accepting our own Yoda, the biggest Jedi. And I'll just end it by saying that this is just a journey. Robert Frost said there are miles to go yet. Thank you.
Thank you both, Nehal and Tushar, who are real pillars of the DDT from the very, very early days, as you can see. And Tushar particularly, we are grateful. He's also done quite a few of the studies and which have been presented in international COPs and other conferences. Now we go on to a very dynamic, very brave doctor from the Northeast, Kachar in Assam, near the Mizoram border, who has set up a hospital from scratch, coming from the Distance Cancer Institute, Chennai, where he was head of Department of Surgical Oncology. He is a recipient of Padma Shri, and he will tell you about his experiences with the Cancer Cure Fund.
Thank you. Thank you very much for this opportunity. See, I work in a hospital in the south of Assam, in a town called Silchar, and the region is as remote as it can get. There are most of our patients work for daily wages, and one of their first concerns when they come into the hospital is about money and the logistics of travel and stay and the length of the treatment. And what the Cancer Cure Fund has helped us do is there are parts of the area which are very difficult to reach. We have to walk for several distances. There are areas which can only be accessed by boat. There are, regions where should a patient fall sick, there is no means of transport. The family members will take a bamboo pole, use a bed sheet to create a hammock, and put the patient on the hammock and carry them for miles till they come to the nearest transport point. And a sick patient in pain, each step can be an agonizing moment for the patient. And for all such patients, can I use the next slide, please? Yeah, so So it's as difficult as it can get, and the Cancer Cure Fund has actually helped us to reach out to many of these people. Just as a point of interest, Ronald Ross worked in a tea garden not far from here, and the malarial parasite, he started his work on the malarial parasite here, and later on he won the Nobel Prize in 1902. Slide, please. And so as I told you, most of them are daily wage earners. They earn small amount of money. They have large families, often have only one earning member, and are easy to give up on treatment. There's no other way for many of them. And the Cancer Cure Fund and the ICS have helped us reach out to many of them. Next slide, please. And I want to quote two significant examples. Before we got support from the Indian Cancer Society, all HER2 positive women, they were not able to give trastuzumab to any of them. And the first time we started trastuzumab for HER2 positive people, patients, women, is mandatory, is a vital part of the treatment. And because of the Cancer Cure Fund, we were able to start supplying her trastuzumab, and now nobody goes without trastuzumab. Same way for DLBCL, where rituximab is necessary. We were not able to offer rituximab for patients. Staplers, most of the time we would use hand sewn, even for a gastric pull to the neck, the mile long suture in the stomach would all be hand sewn. And Indian Cancer Society has helped us use staplers to shorten the duration of surgery. For radiation therapy, where CT scanning is needed in the beginning for planning, as the field shrinks, the CT scan has to be repeated. Because of support from the Cancer Society and the Cancer Cure Fund, we are able to use immobilization devices and use CT scans appropriately for planning and replanning. Slide. And using the funds, we are able to, just to give you a snapshot. Next slide, please. See, this is just a snapshot of what happened last year. We were able to treat about 70, 80 patients, and they came from all parts of the region, from Kachar, from Karimganj, from Hailakandi, from North Tripura, Tinsukia, which is the easternmost part of the country, from Dima Hasao district, which is full of forests and hills. And this is what the Cancer Cure Fund has helped us do this. And for this, I'm very, very grateful for the people who administer the fund, for the people who do the due diligence, and for support. Many of the due diligence members would call me on the phone for a patient, where there was a problem. Nehal would call me, or Tusha. Somebody would call and speak to us just to make sure that we are able to access the support which a patient will benefit from. And all this has happened because of support from the Cancer Cure Fund and the Indian Cancer Society. Thank you very much for doing this for us.
Thank you, Doctor. We have really no words to thank you and admire your commitment for this cause. And I think every word you spoke reflected the concept of partnership, the concept of flexibility, the concept of sympathy, the need to really ultimately do something in the patient's interest. And I think that is the core value of the Cancer Cure Fund. Now we come to our highlight of this program today. Deepak Parekh is a well-known name in the economic, financial, banking circles and needs absolute introduction. As a chief of the HDFC, he has been a pioneer in many areas of banking and finance, a visionary, a doer. What is perhaps not so well known is his commitment to the cause of cancer, which has been amply demonstrated by his support not only to the Cancer Cure Fund and other activities of the Indian Cancer Society, but many other cancer causes. May I now request you, Deepak, to release this brochure that we have prepared today, which is called Decade of Saving Lives, and to celebrate the 10 years of the Cancer Cure Fund. I think.
Thank you, Usha. I now release the Decade of Saving Lives. I put up the
I request all the speakers to also hold up their brochures and put it in front of them so that we can see a bit of your face and quite a bit of the brochure. Thank you, thank you, thank you very, very much indeed. I would now request Deepak.
Yeah.
But please, can you share your thoughts?
Sure. Good evening, trustees, doctors, donors, well-wishers, patients, and cancer survivors present here today. It is indeed a pleasure to be here today at the 10-year celebrity event for the landmark Cancer Cure Fund of the Indian Cancer Society. We are now in the first quarter of 2022, and the big question now is whether we are at the beginning of the end and can we decisively move on from the pandemic. What started as a health crisis in early 2020 manifested into a devastating health, economic, and financial crisis, which is likely to leave a lasting impact on the global economy over the next few years. However, the strength and resilience shown by our braveheart healthcare workers has been noteworthy, as they have fearlessly served the society amidst personal sacrifices and risks. A big realization from the pandemic, both at the central and state government level, is the utmost need for us in India to increase our healthcare expenditure as a proportion to GDP through investments in health infrastructure and availability of skilled healthcare workforce. Although all segments of our population were affected, it was devastating for the most vulnerable communities, the migrant and the daily wage workers, children, senior citizens, persons with disability, and those with morbidity or illnesses. Over the past 2 years, government and philanthropic funds have poured in to manage the health and social crisis. I think in all these years of my lifetime, I have not witnessed a collaboration of government, corporates, and civil society in such epic proportions, all working with a single-minded focus on supporting these vulnerable communities through the pandemic. This further reinforced my belief that philanthropy should become a habit and not an option. In the outpouring of relief efforts for COVID-19, several other diseases have unfortunately been ignored and hence taken a backseat. For example, let me say diabetes. Diabetes, where India is the diabetes capital of the world. Cancer, which is growing at an estimated 9% annually. TB, again, which has the highest incidence and maximum deaths than anywhere else in the world. And cardiovascular diseases. For cancer, the last 2 years have just set back the treatment load for existing patients, but has also showed the pace of prevention and detection for potential new cancer patients. Additionally, with the twin effects of expenditure on healthcare rising and livelihoods being affected, the risk of underprivileged families falling into poverty and death trap has only increased. So the rise in incidence of cancer in India today is alarming, including rapid increase of childhood cancers. This warrants increased investments by the government, the private sector, and philanthropists towards cancer network in India to support prevention, to support diagnosis, and to support treatment. In 2021, the cancer burden in India was 1.3 million people, which is estimated to increase to 1.6 million by 2025. Pediatric cancers have also doubled at 5% of the total cancer burden. Although childhood cancer cure rates are gradually improving, we are still behind the 80% success rates seen in the developed world. So one of the worst sights I have ever witnessed, which I had to run out very quickly, was a children cancer hospital in Bangalore, which we are supporting. I can't tell you how depressing that sight was, in a big room with all kinds of tubes in these little kids who are 3 months and 6 months old. I think it's alarming to see this, and it is so depressing, I can't tell you. I ran out of that room, that ward, as soon as I entered in Bangalore. So how does cancer fit into the scheme of giving, both for individuals and for corporates? Philanthropy has taken a new flavor in India today, quite different from what it used to be 10, 15 years ago. In the past, only large business families and successful entrepreneurs were donors towards capital expenditure, such as construction of new hospitals, schools, universities, where the individuals were largely donating to small charitable causes and religious trusts. Today, India is different. Today, India has a large number of successful professionals and tech entrepreneurs who are stepping forward boldly to contribute to social causes and societal development. Through pledges like the Giving Pledge and Living My Promise, several Indians are committing portions of their wealth to support new, affordable, and quality healthcare and educational institutions. I have personally believed in the philosophy that the first 25 years of your life is when you learn, the next 25 years of your life you earn, and the last 25 years of your life is you must return. At an institutional level, all successful corporations owe a responsibility in giving back to society, irrespective of regulatory requirements. HDFC was started 44 years ago with a deep social conscience to fulfill a gap, that of providing institutional finance to enable aspiring Indians to become homeowners early on in life. Our partnership with Indian Cancer Society for the first of its kind Cancer Cure Fund was born out of this responsibility to provide a social good in an area of established need. So way back in 2011, when there was no CSR law, our response to supporting access to affordable cancer treatment was a moral project and not an economic one. A decade down the line, with 3 funds raising cycles and higher amounts, committed each time by the investors, it reinforced our faith that an innovative and sustainable product, such as the Cancer Cure Fund, can serve as a benchmark of raising funds for solving societal issues and health issues. So I take this opportunity to congratulate the medical fraternity present here today and people who have worked in the past, all the doctors over the last 10 years, who have worked selflessly to give life to thousands of cancer patients that walk through the hospital corridors each year. I also congratulate all the support staff, the social workers, the donors, and well-wishers who have contributed immensely to support this unique philanthropic initiative, which has positively impacted lives of over 10,000 patients over a decade. I'd also like to give one instance where Dr. Sultan Pradhan, who's a famous oncosurgeon, has got free land from the Bombay Municipal Corporation. Free land in the heart of Bombay, in Baikala. And he's almost completed a cancer hospital. The only condition the Bombay Municipality Corporation has put is that he cannot charge a rupee more than what Tata Memorial charges. I think it's a great move by the BMC. I've not seen this kind of initiative by a local body, because when you go to Tata Memorial Hospital, you see scores of hundreds of patients, relatives just sleeping on the pavement around the hospital, desperately trying to get a bed, desperately trying to go into the hospital. This will relieve the pain. It is reasonably close to the Tata Memorial Hospital, and I have faith that Dr. Pradhan, whom we have supported in a large way together with other corporates, that new cancer hospital and state-of-the-art hospital is going to be inaugurated by the end of this year. So as we move towards better times, let's hope that humanity emerges from these tough times. So we become more resilient and equitably balanced, both towards human as well as our planet. We are at inflection point, and our resilience and courage will take us forward. Although our current reality is anything but normal, we all have the unique ability to reinvent, to reboot, and reset our lives with courage as our capital. I'm hopeful to see a healthier and better future for us in India. My best wishes to all stakeholders, employees, patients, and their families. Onward and upwards for 2022. Thank you.
It has been a truly, truly inspiring talk. You have completely increased the level and raised the bar of this event itself, Deepak.
Thank you.
And I cannot thank you enough. Philanthropy should become a habit, not an option. Learn, earn, and return.
Yeah.
These are some catchy phrases we are taking away from you today. And I'm extremely grateful to you for having come, for having released the brochure, and for sharing your thoughts. It truly reflects your passion and your commitment that you give this such a lot of priority. Thank you so much. I would now like to give you all a glimpse of the brochure. Most of the subjects covered in the brochure have already been referred to by the various speakers, but here, this is the first page of the brochure, A Decade of Saving Lives, the Cancer Cure Fund, and the Indian Cancer Society's slogan in the Rise Against Cancer. The children in this picture shows children who've been supported by the Cancer Cure Fund. And then we get on to the next slide, which shows the cumulative impact of the Cancer Cure Fund over the last decade. Starting from just about 84 patients in the first year, we have added on successively over the period. And now, like you see from this graph, it's been a steady growth, and we have now covered 11,000 patients all over the country. So here you find the eligibility criteria, what the support covers. And here it's important to realize how adaptable the scheme has been. Like Dr. Kannan mentioned, there are some things for which the Cancer Cure Fund, based on the judgment of the expert doctors, decided the coverage would be there, which may not be available in other schemes. So for one patient, the maximum eligibility is 5 lakhs, and for bone marrow transplant up to 8 lakhs. The same is by and large, in our experience, enough to cover the cost of treatment of most common cancers. And we have been constantly reviewing the cost of treatment and benchmarking these so that all applications are really assessed in terms of these benchmarks. The survival criteria of 50% for adults and 70% actually for pediatrics, although effectively we find that in India, we are nowhere near the 80%, we are nowhere near the 60% mark either. But we do have that survival criteria for childhood cancers. It's actually sometimes a painful criteria to think about, because clearly we would like to help anybody who has a need. But when you think about the cases of people who can be helped return to normal productive lives, there is a certain sense of priority that is there. And so the survival criteria we have really stressed a lot in the Cancer Cure Fund. Next. The empaneled hospitals, as you heard, are all over the country, and this map in the brochure shows you the number of patients from that state. Although you find a large number of patients from the eastern and central parts, many of them come flocking to the southern hospitals in Chennai or Vellore, and huge number do come to the Tata Memorial Hospital. So as a part of distributing accessible and affordable care to all parts of the country, we have tried to select hospitals which meet our criteria and who are willing to forego all the hospitals in the in the Cancer Cure Fund. They forego the operation theatre charges, professional charges, and the room rent and the OT charges. And these are the hospitals that we empanel, plus are following absolutely standard of care and are holistic. But we would definitely like to increase the number of hospitals. There are various ways in which, for example, Tata Memorial Hospital has set up a whole lot of hospitals across the country. They're also trying to improve the quality of care through the National Cancer Grid. But I think the real need is for spreading affordable and accessible care. And one of the ways to do it is really to have really good hospitals in nook and corner of this country. Next. We have a work process which has been explained in great detail, so I don't want to go through this. Go on to the next slide. It's not actually a next slide. These are all pages from the brochure. So gender-wise, we find about 50%, 50% gender is more or less equal. And that is mainly because you find a large number of patients are supported for breast cancer. And like Dr. Kannan again rightly pointed out, a huge amount of the patients are given support for trastuzumab, which is not available under many of the government schemes. Age-wise, 43% are between 15 and above 45 years of age, and below 15%, it is 28%. We had conducted what we wanted to know whether the Cancer Cure Fund has been achieving the objectives it had before it. So as a median follow-up of 5.7 years in a cohort of 516 patients, we examined the follow-up and found that 51% of patients were alive 5 years after treatment. Of which 3 were alive with the disease, but most of them, 48%, were alive without the disease. So this validated our selection criteria and our real meaningful attempt and effort to see that as many lives are saved as possible. So now I would like to actually conclude my part of this at this stage. And hand over the mic rather to Naveen, who will take you through the way forward. Prospect for cancer care in India, especially the financing aspects. Over to you, Naveen. Naveen, as you all know, is a corporate leader. You'll find that the Indian Cancer Society is full of corporate leaders. We've had CEOs from every single biggest company of this country. But he particularly has been leading the Indian Cancer Societies very dynamically in the areas of creating great communication, awareness, screening, medical education, and clearly driving the message across the country. He thinks big, he acts big, and I would like him to share his thoughts. Over to you, Naveen.
Thank you, Usha. Good evening, everybody present here. And I'm told the latest figure is 175 people are attending this from various parts of not only Bombay, but beyond Bombay. And as the last speaker, I take the liberty of looking into the future. It's late evening, so I will make it tight and short, I assure you. So here are a few thoughts on the way forward for Indian Cancer Society at a very high level. And then after that, just a few thoughts on how to reduce cancer incidence through aggressive prevention initiatives and how to improve affordability of cancer treatment in India, certainly the common cancers and certainly for the weaker section of the society. The common cancers constitute 30 to 40% of all cancers in India, and they are oral cancers, cervical cancer, breast cancer. So as regarding Indian Cancer Society, as you all know, we operate in the wide spectrum of cancer space, from one, awareness creation to screening, and that's a key plank. These are key planks of prevention. Two, diagnostics and treatment support for the underprivileged, and you heard about that in great detail today. 3, survivor support, registry, and medical initiatives. Today, we shared with you our globally unique Cancer Cure Fund. But in recent years, Indian Cancer Society has moved to the very next level or beyond in all other areas too. For example, we now have had quite unprecedented, high decibel cancer awareness messaging, but in a very engaging manner, reaching tens of millions of beneficiaries. You know what? We don't want people to switch off the radio or the television or stop reading on the mention of Big C. So that's been our focus, to engage people in a very non-threatening fashion. And I think we've been fairly successful in that. We've created a national footprint of screening, and it's multiples of the past. Let me share some of the new innovative programs. Survivorship program is novel in India, and it provides sustained, multifaceted support to the underprivileged young cancer survivors. It's now gone to 10 hospitals across the country, and our aim is that it should cover all the NCG hospitals, and there are about 175 of them, and beyond that, next couple of years. We have created and launched a globally first novel program to refresh the GPs who are deep down in the pop strata on timely cancer diagnosis. What is the purpose? The purpose is to significantly improve early detection. As I will say that later on, 60 to 70% of the people come for treatment when they are in stage 3 or stage 4. And this is almost twice that of what happened in the West. So one big reason is that apart from individuals, even doctors out there, the GPs, who are the first port of call, could do a more diligent job by keeping them updated. Number 3, ICS has inspired an insurance company to design and offer a family insurance against cancer at an unbelievably attractive price. It's going to be launched very shortly. This has been done, obviously, by an insurance company, but the idea has been sort of proposed by us. But as the apex NGO in cancer space by miles, our role is beyond just doing. Over the years, we have been focusing on doing, showing the way forward to others, to our branches, to our affiliates, but we've got to go beyond. We need to enable big things by helping build NGO capability and capacity in our ecosystem. Be an opinion leader, influencer in the public and government forums on cancer policies. Towards this, we recently participated in a FICCI forum to discuss ways of minimizing the incidence of cancer and also addressing cancer treatment affordability to make it more accessible and affordable. Here are some of the thoughts which we presented and were discussed. As a country, the biggest effort we need is in cancer prevention activities. That means awareness and screening. I told you about 60 to 70% patients in the stage 3 or 4 when compared to the West. At that stage, the cost of treatment is high, the prognosis is poor, so there's also a lot of social and emotional trauma apart from monetary aspects. So we need to increase early detection and thus reduce the overall cost burden of cancer in our society. Sustained effective communication reaching wide and deep, supported by effective screening centers. There's no point just talking about making people aware. We have to suggest where to go to get themselves screened against the common cancers at least. And in this, the NGOs, the private sector, and government need to collaborate intensively to make this happen. ICS is piloting one very big cervical and oral cancer program. Both of these cancers, by the way, are preventable cancers. I know they are truly preventable if they are picked up in the very early stage. We believe government should vigorously facilitate collaborative work amongst NGOs and with NGOs. 2, there's a compelling need to consider further reduction in delivered price of cancer medicines to the underprivileged. We are seeking reduction in the GST from 12% to 5%. 3, there is a dire need for research and development of biosimilars, which could replace expensive patented imported drugs. Indian pharma industry has had a great track record in this area, and I believe government should incentivize this by tax breaks within the framework of what the intellectual property is. There can be some collaboration. Many things have been done. 4, alternative healthcare financing mechanism for cancer patients. At present, very few people are covered by insurance companies for cancer. Ayushman Bharat covers people from BPL section, but the limit of reimbursement is only 5 lakhs, and that very often is inadequate for a full treatment of cancer. While we see there are lots of programs for the lower income group, I think the middle income group, which is increasing, is left rudderless. And I believe government and charitable institutions should create special assistance for this left out economic growth. Delivery of aid. Today, one of the biggest issues is the delay in delivery of the aid which is given by government. It can often take over a month or more for sanction and transfer of monies while the patient is desperately awaiting treatment in the hospital. And remember, many patients do come at stage 3, stage 4. So rapid delivery models, including due diligence like that of Indian Cancer Society, could be adopted, with a total time from appeal to funding is about 18 days. It's about half of what happens in government aid programs. Insurance, I touched upon that earlier. There is a crying need for cancer insurance to protect lower and middle income people from the financial trauma and effectively poverty. Lower income family, if they get affected by somebody having cancer, and if they don't have the wherewithal, it is a sure route to poverty. Government support for innovative insurance schemes is needed. For example, we would be happy to sort of go around funding the insurance of poor people, etc., and ask corporates to support us in that effort. But it needs to be a part of the CSR scheme. At the moment, we are not sure. We like to. This is a new idea. Finally, I want to close by saying the cancer NGOs need to come together. We can be an apex body, create an association, be the voice of patient community, which is unfortunately lacking. We need to play a key role in India's cancer policy development. So I think there are big challenges. At the same time, there are big possibilities and opportunities out there. Together with our other stakeholders in the wider space, other NGOs, private sector, government, we can make a big difference and bring down the numbers which Deepak talked about, and other talked about. 13 lakh new cases every year, 27 lakh people, 8 lakh out of the 13 lakh dying, to bring that number down very sharply. So I want to close here and thank you everybody for being here. So especially our honored guest, Deepak and Milind, Dr. Banavli, Tushar, and other doctors, and of course, people who have come from impaneled hospitals. Thank you very much. I then hand you this back to Anne or Usha with this
Thank you.
sharing of thoughts.
Thank you so much, Naveen, for that broad spectrum of ideas as always. Now it's my very pleasant duty, which is really to propose the vote of thanks. Of course, Naveen has thanked the speakers and the hospitals. I just want to give some figures to you. The DDT has met 470 times since inception, and the GAC held its 217th meeting yesterday. You can imagine the enormous amount of effort is going behind this Cancer Cure Fund. For this, I thank every member of the GAC, every member of the DDT, and the Navya team, all working pro bono. This is something amazing, and I don't think very often you see this kind of a unique collaborative effort. This slide, which is again from the brochure, shows you the prime donors, and we are extremely grateful to these donors. I cannot now forget that. Philanthropy should become a habit, not an option. I think we should just sloganize that. Apart from these, there are thousands and thousands of individual donors. There are other corporate donors, small, large, who have contributed and added to the Cancer Cure Fund. Our deepest gratitude to them. Without them, we could not have carried out this journey. Next, I would like to thank for this event, and not only for this event, in general, the Navya team, of course, whom I said have been given us this tool, which has enabled us to save on doctors' time. We have the Rolson Infotech CCF software, who has been able to go from a paper-based and physical meetings to now a paperless, completely online meetings and online processing of all the applications. We have Nihar Vete, who drafted this brochure, and Rama Shankaran, who carefully copy edited and designed by Pooja Jain and her team. And for this event, we had the films that you saw, and you'll be seeing one more film. Yogi has always been there to us, just at the port of call, and he is so wonderful. Showbiz Experience, particularly Fariz, is the event organizers, and they have done a wonderful job. Last but by no means the least, is the CCF team. The CCF team, led by Anne, you can see right in the center. She is, everyone knows, the empaneled hospitals, the GSC, the DDT members, the Navya team. She's absolutely the fulcrum and the center of this Cancer Cure Fund team. And she and her team relentlessly work. This event was today, and yesterday and day before there was a DTT team, there was a GSE team, 100 applications, everything processed, everything sent. Today the money disbursed. The turnaround time, the follow-up, everything is thanks to this dedicated group of people. And the bottom, second from the left, is Ranjana, who has been with the CCF team right from 2010 and from inception, and her dedication. You know, this little girl, Nidhi, was so reluctant to speak. Ranjana calmed her down. She was nervous. Her mother, Jyoti, was nervous. But the way Ranjana deals with patients, follows it up, brings in a human touch. Even though we say we don't directly deal with patients, I find patients come to us willy-nilly, at least to get the support. So I just have to place on record the wonderful contribution of this DDT. Thank you all very much for being here this evening. Thanks to all those 170 people who have tuned in. We are extremely grateful to you, and we do hope that a recorded, of this event will really go online shortly. We'll also have the brochure printed and available to whoever who wants it. Thank you all once again. Thank you very, very, very much.